Welcome to another episode of Real Health Black Men. Thank you for listening. Today, my guest is a friend, Dr. Yaw Nyame. He is a part of the University of Washington School of Medicine and the Fred Hutch Cancer Center. According to the stuff I read about you, it says that you're a surgeon, a researcher, an educator, a patient advocate. So we're going to talk about all of those things today. But instead of me trying to define you or what other people define you by in the writings, maybe we'll begin by letting you introduce yourself, telling us who you are, where you're from,
Sure.
and what you
I was
do.
worried you were about to read that really long bio. Our academic bios are always awkward. I feel like we probably could borrow from other industries where the bios sound less stiff. But let's see. How would I describe myself? So I would describe myself first as Ghanaian American. I'm really proud to identify as both. I grew up in the great state of Oklahoma. Great sometimes, not so great others. Great right now because the Thunder are rolling. And let's see, I went to undergrad at Duke University, so that's my alma mater. And then I went to graduate school both in DC and in Chicago. So Northwestern is where I did my training for medical school and business school. And then, what's funny about medicine is like no one understands how our training works, right? But I
Yeah.
was like a medical student, so I was paying money to become a doctor in Chicago at Northwestern, and then you graduate, but then you're still learning and training, but that at least you're getting paid then. It's a small salary, but you're officially a doctor, and that's residency. And I did that at Cleveland Clinic. And then after 6 short years of training, just a brief 6-year period of being an apprentice, I came out here to Seattle, and did more training, actually 2 more years, and then stayed. But finally, I got my first quote unquote real job where I practice urology, right? I take care of patients who have urologic problems. My extra 2 years of training was basically to become a cancer specialist. So that's what I do. I take care of cancer patients um, that have cancers that are specific to urologic organs, if you will. So urology takes care of urinary and male sexual organs, and the prostate is like by far one of the most common sites of cancer of any type. And that's a lot of what I manage, and that's how we met.
That's how we met, yes. So tell us a little bit about your family. Are you married? Do you have kids?
Yeah, been married to my beautiful wife, Christy. She met me at the very beginning of that short 6-year journey in Cleveland. That's where she's from. And we got married towards the end of that journey. And we also had my daughter, my oldest of my 2 kids at the end of that journey. So now we have an 8-year-old and an almost 6-year-old. And as you can imagine, our lives are busy and full, full of
Yeah,
all the good.
full, yeah. Lots of stuff going on at that age.
Oh man, you wouldn't believe it. Um, but they keep you grounded and humbled. And the best part of my day is going home and hearing what they've been up to. And I try to read to them if the days hasn't been too long, and we all have the energy for it. So,
Well, that's good. At least you get the time to spend with them. Those 18 years are very important and they go pretty fast. Take it from somebody
absolutely.
who's on the other side.
The iPhone is like the worst and best thing, and it keeps giving me these reminders, 4 years ago, 5 years ago, and it's like,
hmm
it's hard to believe that much time has passed so quickly. So I
Yeah.
really am trying to cherish every day with them.
Well, I applaud you and I encourage you. So our topic today is men's urologic health. Our discussion is going to focus around that topic. And it's not a topic that I've heard much about, at least focused from that area, men's urologic health. So if you could give us an introduction to what is urologic health and what is men's urologic health and how we approach that topic, I'd appreciate it.
It's funny you mentioned this, and I'm smiling because, like, when I got into urology, I wasn't like that was furthest from what I thought I would be doing when I entered medical school, right? In fact,
Hmm.
we used to have these teaching modules where we did physical exams and interviewed patients in medical school, and they were these paid actors that would help give us feedback on our bedside manner.
Mm.
Um, and I remember after we did the urology block, I called my dad and I said, "Dad, no matter what I do, it's not going to be urology. It's not going to be what we did today, man. I'm not doing any of this." Um, but as I got further into my education, what I realized was there was a special bond between the urologist and his patient, touching on really sensitive issues, managing like really impactful quality of life issues, um, that I really enjoyed, and I enjoyed being able to be that trusted source for men. And guys, we're not always seeking health advice. We don't foster relationships with doctors in that way. So I felt like um, maybe I had like a more natural inclination and gift to have a bond with a patient in general, but with guys, and maybe I could use that to be their advocate, help them seek health. So, what is urologic health? Well, really it's urinary function, right? That's number one. So when you think urology, you got to think kidneys, the tubes that drain the kidneys, the ureters, and bladder.
Mhm.
And then the bladder is kind of like a repository for urine that has to empty. And so the urethra is what empties it. Okay. So that's on the urinary function standpoint. And we all know like bladder issues are really common. If you think of what like impacts your quality of life the most,
Mhm.
once you get beyond like having a clear mind, being able to walk and, like have general function, like your urinary function and your bowel function, those are like important parts of your day, right? So
Mm.
anyone who has a disruption of that is starting to think like, hey man, the things that I hear from friends, close friends, but happy a lot. Is that a problem? Or like, I've noticed my stream is slow, or any variation of that, right? And that's what your urologists take care of. For men, our bladders empty through the prostate, right? So the prostate ends up being like, has the potential to be a dam for urine flow. So when we talk about men's health issues, on the urinary standpoint, it becomes the risk of having difficulty urinating when you get older, and then kind of some classic urinary symptoms that people can have in all ages of life, which is kind of that overactivity. Like, am I going to the bathroom too much? Um, the second component of it is sexual health, right? Because I said urologists take care of urinary issues, and sexual function related issues, especially for men. And so erectile dysfunction and fertility, um, those are things that you may seek a urologist for. There are obviously diagnoses. Like I have to say this here, right? If you have blood in your urine, that's not normal. Like you're supposed to see a urologist for that, okay? So there are things like that, right? That kidney stones. There's a lot of stuff you may see for a urologist for. But when I think of men's health, really, from a quality standpoint, it's about urinary function, it's about erectile function, it's about fertility, and those are probably like the three big categories that I would throw there. As a cancer specialist, I'd be remiss not to say that there is also probably a responsibility for most males to be thinking as they get older about their cancer screening and cancer surveillance. Prostate cancer is just so common that I think a good lens towards men's health is also the preventative things that you can do to avoid, serious illnesses such as prostate cancer or even testicular cancer, right? So for the 20 and 30-year-old guys who are listening, yeah, you should be checking your jewels, in the shower at least once a week. Make sure there's not a hard spot or anything weird, because that's good. That's just good maintenance, right? To make sure you're keeping yourself in good health.
So we got to the blood in the urine and people doing cancer screening. We're talking about everything from the urinary system to the sexual health to how we all function from that urological standpoint. So
And it's interesting. We're talking about urologic health and men's health, but also there's some hormone function too, right? Testosterone levels. And testosterone levels can be low in some men for a variety of reasons. And then sometimes normalizing that can really improve quality of life. I'll plug this. I mean, this is not what we typically manage ourselves as doctors in the urology space, but you also want to think about the importance of m- mental health too. And I think that there are different types of shops that exist across the country that provide men's health support. And I think many of them are going to touch on, from a urologist standpoint, many of them are going to touch on all the different aspects of care and life that I just mentioned. But um, and so it's a really important topic, I think, and as a group, right, and men of color, sometimes we only take care of things when they're at an extreme, right? There's no that preventative mindset, that maintenance mindset as much. I don't want to overgeneralize, but definitely that's what we hear when we're in our peer groups, right? Like when we have our advocacy group together, you and I, we hear the guys share that. So I think it was a really timely topic to just put out into the universe that, if you're a guy in your 20s, 30s, there's a role for you to be checking in with a doctor and asking questions and getting a better understanding of how all those things work, and not waiting until you're 65 and not able to pee to be thinking about your prostate for the first time, right? Or feeling hopeless if you're experiencing something like erectile dysfunction or sexual dysfunction in your 20s or 30s, to know that there are specialists out there and people who can help and to think about it holistically. So, yeah, that's part of what I hoped our discussion would be about today.
So let's continue in that vein. How does a person go about assessing their urologic health with their doctors? I mean, how would that start? Is that like a part of a regular annual exam, or is it a separate process?
Yeah. I mean, I think it depends on what station you're in life. I will say that probably the most important person in the discussion around men's health and many of these topics I've talked about, and maintenance and prevention, is your primary care doctor. They're trained specialists, often much better communicators, have a broad understanding of medicine and your health, can be your biggest advocate. And so I think establishing a medical home, meaning like having a doctor that you build a relationship with in the primary care setting, someone you see frequently, is critical. And then I think utilizing that person, um, hopefully you can make sure that you're getting in any questions or concerns you have about, urology related health, So those questions, again, it's interesting. I was starting to go down this path, but when I got the job for urology in Cleveland, one of my buddies, his dad pulled me aside. He said, "Hey man, these guys, all your friends here, they're giving you a hard time about becoming a urologist. Like, why are you going into this? They're all going to be calling you in 30 years." And I was laughing. And it didn't take 30 years. It literally took about 5 or 6 before the first guy phoned and said, "Hey, I got this problem. Is this normal?" So,
Well,
um, I think the ways the primary care and having that relationship is critical, and then just not being afraid to put it out there, right?
mhm.
Asking that doctor if something you're experiencing is normal or abnormal, because they're going to be the ones typically that will say, "Okay, hey, we've checked your testosterone, it's low. Maybe you should go see a urologist," or, "You know what? Let's try this medicine for your urine flow. If it isn't better, hey, now we're going to kick it to someone like Dr. Nyame."
So it's not a separate set of tests; it's part of the primary care, and then so I'm trying to get at, you don't have to set a separate appointment. Say I'm
No,
going
I
for
don't
my
think
urology test. It's just part of your normal care.
I think you can establish this to be part of your normal care. Now, there are men's health clinics all around the country. So I think if you feel like you need that specialist, you go to their website. Hey, they take care of an issue that I want direct, from a specialist. information on, you certainly can request a referral, and people approach it that way. But I also want to normalize that men's health doesn't have to happen in a specialty men's health clinic. I think men's health is what an average primary care doctor is going to be providing his male patient when he comes in to see him. Problem is, too many of you guys don't have a primary care doctor, right? So you don't have the opportunity to get that tailored men's health treatment or advice or care. So that's really what I wanted to answer your question. I think you could have it both ways. Probably the easiest is just getting a doctor, right, and seeing somebody regular.
Okay. So we see a lot of ads on TV or sometimes I hear on the radio about, as you get older that you were talking about men's health, men's clinics, that you need to go because you need more testosterone and you got to get more testosterone because testosterone is what keeps you alive. Um, is there something to that, or that as we get older, we need to be bulking up on testosterone?
Oh man, this is not my specialty at all. What I will
Okay.
say is there's a lot of misinformation in the world. The one thing about testosterone replacement is that it's not benign, right? So remember, if you are of age where you're really wanting to be fertile and fertility is important to you, that if you take exogenous testosterone, that any form of that external supplement, it's gonna drive your sperm counts way down. Okay. And so that's not benign, and definitely don't take it if you're trying to start a family or have kids. The second thing is that it can cause your blood to get too thick. Okay, so that's another reason to be weary and careful about, advertising that just says, "Hey, at any problem you have, just take testosterone," right? And three, it's the effectiveness has only been shown in patients who actually have low T levels, okay, and have symptoms, okay. Both those things have to be true. So if you have symptoms and your testosterone is normal, oh, I feel tired all the time, and I feel like I'm losing muscle mass, but you get your T checked and it's like 400 and it's normal, don't go replacing, because there's no proof that that's going to be beneficial. And the same is true too. If you go get tested and your T is like 150 or low, and but you like are a marathoner, you feel great and energized and whatever, I'm not sure replacement is what you need, right? So
Mm.
I think a lot of it has to be getting your levels from, if they are low, to a normal, and then and you have to be symptomatic from, or have symptoms, so feel tired, feel like you're having a decrease in muscle mass, less libido from having low levels. And also don't forget, and I think this is really critical, that testosterone isn't just a freebie now, right? That there are real side effects. I mentioned too, the fertility thing, maybe some guys are like, great, but I wasn't worried about that. But that thick blood, can cause strokes and other issues if it's not being monitored. So this isn't like a medication you just want to be on and not worry about it. You definitely should be getting routine blood checks to make sure your blood's not too thick.
Yeah, that's good. Thanks for clarifying that because we hear lots of ads about that. Now, some men say that if I'm not having any pain, everything feels good, everything's working good. Why should I go to the doctor? Why should I care about my urologic health?
That's a great question, right? And the truth is that we have made so many advances in medicine that some of the things we're able to pick up don't present with symptoms anymore. We pick them up because you get blood work. I treat a lot of kidney cancer here in
Hmm.
Seattle, right? And a lot of kidney cancers are picked up because we have CAT scans now. So you go into the ED, your belly hurts, or I don't feel very good, I have a little bit of diarrhea, they get a CAT scan, right? Because we have that ability. Oh, by the way, no, the diarrhea, probably just something bad you ate, but you've got a small lump on your kidney, right? So part of the reason you want to be getting checked in is like there's some critical blood work that can get checked as part of your primary care visits that help you stay on top and ahead of some potential issues. one of those is prostate cancer, right? We've kind of alluded to it. We're talking about men's health. I think 315,000 people are going to be diagnosed with prostate cancer in the United States this year. To me, you can't talk about men's health, men's urologic health, and not talk about the risk of prostate cancer. Well, if you want to beat it, one of the best ways to do it is to screen, right? And certainly you should at least be in a position to talk to your doctor about whether or not you want to get a simple blood test to, be on the lookout for a cancer that affects 1 in 8 men in the United States. So I would say waiting till you have symptoms is often waiting till it's too late, from my perspective.
Yeah, thank you for making that clarification because that's a great way to say it. Obviously, you're better at to say it than me, but there's so much technology out there. Part of the reason for this podcast is help men to see that the technology and the science is growing so fast that a lot of the things that they used to think about that they have to do now, you don't have to do. Your blood test will pick it up and your screenings will pick it up. And waiting for pain sometimes means that you're letting things progress in your body that you could have learned about if you were just paying attention or having your physicals or going to your doctor. Because I keep getting that question once people find out that I have prostate cancer. The next question, half of the time, is, well, how much pain did you have? Why did you go in? Did you have pain? I was like, no, it was no pain. There wasn't any pain until I got out of the surgery, right? And they're like, well, how did you
I hear
know?
that all the time with newly diagnosed patients. Like, doc, how can you be telling me I had this bad cancer? I don't have any symptoms. And I always say good, because when you have symptoms, it's usually too late,
Hmm.
or it's like too far advanced. And so if you have no symptoms, we have in my opinion, oftentimes the maximum opportunity to help. Now, we could have 2 full podcasts on prostate cancer screening. It's not as
Yeah.
that simple, right? Because certainly there is some potential downsides to having the blood test. But look,
Hmm.
you can't find out if it's good or bad for you unless you go see somebody, right? And
Right.
I think that's kind of the key message for today. The other thing is, like, things have changed, right? When I started in medical school in urology, a finger exam, good old
Hmm.
prostate check, Dr. Dre, as our friend Kojo calls it.
Go your cause. Yeah.
Yeah, Dr. Dre, the digital rectal exam. That used to be required, like non-negotiable. And we're learning more and more that, look, get the blood work. If it's abnormal, we tend to get MRI, right? We get a picture.
Hmm.
All of this is non-invasive, doesn't require any physical examination. Now, biopsy is invasive. I'm saving that for later as
Hmm.
part of topic still. But at least by the time you get to that biopsy, if you need it as part of your men's health, you usually have lots of corroborating data to say, hey, the risk is high enough that we should do this, right? And that's
Hmm.
the kind of medicine we're trying to practice these days. So I would say, when it comes to how to do men's health, the first step is make an appointment with a doctor. And the best time to do that, honestly, for all the guys who are listening, don't wait till you're in your, 40s, 50s. Build that relationship early. Because the more of an established relationship you have with a primary care doctor, the more they can serve you, the more they know your values, the more they have of your history, the better the relationship they have with you to be your advocate. So I'm a big, big, big proponent of, building these relationships early. And you probably don't need to see them every year when you're in your 30s. You go every other year, every 3 years, something like that. And then they will be able to say, hey, you're due for your colonoscopy. Hey, you're due for your PSA check. And, hey, you're 45 now, probably should see each other every year, and they're going to tailor it to what you need. So I think that's a really nice approach to think of using for men's health care.
So, any other topics on the men's urologic health that we need? Any other areas we need to touch on? We touched on the bladder and the urethra, the urine, the cancer
Yeah.
screening.
We've
Uh,
talked fertility is the only thing we haven't talked about, right? And I'm not a fertility specialist. There are a lot of couples in America who want to be pregnant, who want to get pregnant, who can't or have difficulty. And this, like many topics in medicine, this is one of those quiet sufferings that a lot of people go through, a lot of young people who
Hmm.
go through. I think if we can normalize the discussion, that this happens and that there are doctors and specialists that help, I think is a great forum to do that. And so, what does a men's health urologist do in the fertility setting? Well, they usually do the evaluation of the guy, right? So as you
Hmm.
listener, and that's good to have somebody who checks you out to make sure that from a fertility standpoint things are working well. And I could say I myself have gone through a process like that, right? It's awkward, and but it's good to do, right? Because listen, I'll tell you, whatever you think you have to do that is challenging as a guy, the female workup is really intense. Right?
Hmm.
And so oftentimes it's it's important to know that you have a doc that looks you over and makes sure that things are working for you from a fertility standpoint if you're not able to get pregnant. And I think again that's part of men's health. I will say that we define infertility, so the difficulty to achieve pregnancy, we define that usually as a couple who've been attempting for a year. So,
A year. Okay.
um,
Another question here is tell us a little bit about your research and some of the other things you do. So you're a clinician and you're also a researcher.
um, so I spent 50% of my time here at the university taking care of patients, right? So that's seeing patients in the clinic and doing surgeries. And I spend the other 50% of my time doing research, which really for us has been building a program that's a little bit unique in prostate cancer research in that we really value the partnership with cancer survivors. And specifically for us, we've been working with Black cancer survivors, prostate cancer survivors to co-develop research, co-develop, we call them interventions 'cause it makes us sound fancy. We're co-developing essentially, plans of action that we get to study and test and perfect together. So, for instance, I've been preaching about PSA testing, and, we've been working on a project where we're trying to figure out what's the best way to do screening for Black people across the country. And we've been putting in a lot of work over the last 2 years to come up with a research plan, as we call it, so that we can figure out, hey, you know, is approach one or approach two going to be the one that helps the most people? So it's a fun research practice. It's a little bit different. I'm not working with test tubes. I'm not collecting a lot of samples presently. I mean, I used to do that kind of research, but right now it's a lot about getting guys like you together, talking about your experience as cancer patients, having you guys help us understand where the need is and what tools are going to make a difference in making cancer care better for Black patients. But ultimately, if we make it better for those that are at the margins, we make it better for everybody. I really believe that as an equity researcher. It's if we take care of the people who have the hardest time accessing, health care, then we improve it for everybody else as well. So that's really my mission.
So you talk a little bit about patient informed research, and why is that important? Why do you think that's important?
Yeah, I mean, I think as clinicians, it's easy for us to sit in the ivory tower and, everybody tells you, oh, doc, you're the expert, right? Right. A lot of the things that we administer, we don't live through, right? And so I don't, you have a let's say you got a 9 a.m. appointment with me. I don't know what happened on Monday. I don't know what your Sunday looks like. And, I'm new to Washington State ish. I've been here 7 years actually. I gotta stop saying I'm new, but I don't know what it was like to drive over, the pass or to get here from Yakima or whatever. So I don't know how much time you had to take off from work. I don't know who's in your social circle that you've talked to about your diagnosis. I know very little about what it's like to have incontinence after surgery. I tell a lot of men what I've heard it's like, but I haven't lived it. Mm. And so it's really important to me that we go straight to the source to understand what these problems are like. When we do this, what we learn is how to modify our research so that it's better, right? So that if we decide to open a study, people sign up for it. If we ask a question, it's one that's important and is going to have the most impact if we answer it, right? And our field is littered with studies where really smart people got millions of dollars to do something, but people wouldn't sign up for it, or the results ended up not being that useful because I think they weren't as informed by patients as they needed to be. And you and I, we've talked a lot about this. My analogy is like, if I was going to open a coffee shop in your neighborhood, could you imagine if I didn't knock on a few doors and ask people what kind of coffee they like, if they thought they needed another coffee shop on the block? And what we do is the equivalent of just open a coffee stand, sometimes right next to the Starbucks, and then we're like, hey, how come we're not helping? But how come we're not selling any coffee, right?
Not selling much coffee. Yeah,
Yeah.
you didn't do your
People are
homework.
you
Yeah.
didn't do the homework, right? No, I think so. It's just not about being patient informed, honestly, right? But it's about being patient partnered. I think that the coffee shop analogy is a good one, um, in that you could imagine if you really had a target demographic that you wanted to sell your coffee to, maybe young people, you might go open that venture with kind of a young influencer or someone who has a pulse on that community in that neighborhood. So that's like taking it one step further than just talking to some young people. But you know what? Why don't you help me with the design of
Hmm.
the interior and the menu? And like, hey, do you think like young people care if the coffee is from Ethiopia or Brazil or whatever, right?
Hmm.
That's what I think we're doing that's different in the research is that we're taking it one step further than just saying, what do you think is important? But it's like, come along for the whole ride. And we've seen that how fun and impactful this process has been. And I think between you and me, we're on the verge of something really big developing within the next year or two for our research team, which includes you. And that's exciting.
Yeah, I think we do some good, interesting work on interesting teams, and the stuff that we are studying is really interesting. You spoke about your research is focused mainly on black men, black because prostate cancer affects men. Why do you think focusing on that subset is so important?
Yeah. And black men are 60% more likely to be diagnosed with prostate cancer in the United States. I said 1 in 8 men would develop prostate cancer in the US, 1 in 6 if they're black or have a
Hmm.
strong family history. The reason for that, we don't know, right? So I think oftentimes we jump straight to the biology, but biology definitely plays a factor, but not all of this risk is what you're born with, right? So there's got to be some other environmental components. And I say environmental, I use that as a big catchphrase for a lot of different external factors. I don't know, is it stress? Is it the water? Is it the air? I mean, it could be, or is it some combination of all of that? Um, Probably the most sobering thing is black prostate cancer patients are twice as likely to die from prostate cancer as their peers. This has been true for over 50 years. I have a student who is doing a project with me, um, and we were calculating the burden of prostate cancer death among black people, and it came out to 1.5 million years of life lost over the last 50 years per 100,000 black people, right? Black
Mm.
men over that time period. That's a staggering amount of burden that has been shouldered by the community. To me, this is like a public health crisis. This isn't just an interesting statistic on disparities. This is something that we are living through. We've lived through for 50 years. It needs to be addressed. And, I think when I think about what we're losing, we're losing culture, we're losing economic stability, on a social stability. Often when we lose men in their 40s, 50s, 60s, and 70s to prostate cancer. So to me, this is something that's critical to address. I said my equity lens always has me thinking, how do we make it better? How do all boats rise, right? And I think if we can really address this particular disparity by figuring out ways to better inform patients about screening, how to support better access to treatment, how to access better survivorship care once you've been treated, making sure you have the latest and greatest. And we can make those tools available to our most vulnerable populations. Yeah, it's kind of a slam dunk that kind of information could also help other people in other populations. So that's the drive. We talk about quality care all the time, right? One of the key tenets of quality care, as defined by the National Academies of Science, is that it be equitable. I know that's a bad word these days, but if you're not delivering something of high quality if it's not equitable, and so that's the focus of what we do, man.
Just to wrap this up, what would you say are the three takeaways that you would like the audience to get from this conversation today?
I think learn to be curious about your own body and health, especially for the young fellas out there. I mean, I'm not embarrassed to admit that I didn't know very much about the prostate or men's health until I was well into my, almost 20s, late 20s, right, in medical school. And so be curious about what's going on with your body and protect it, take good care of it. Number two, it's never too early to establish a medical home. Doctors, we're here to help. We want to help. We want to get to know you too and know what's important to you and support those things, right? So building a foundation in a medical home early allows you to get knowledge and get reputable, accredited knowledge in your back pocket. And then it also hopefully you build a relationship that sustains you for a long time, because that's important. And then number three, I think a key tenet of men's health is, selfishly, I'm going to say is prostate cancer. And I think I want to increase awareness about that as an issue to include with all the other things that are important to men's health from a urology standpoint, making sure you pee good, making sure the erections work, making sure that you have good fertility, and that your testosterone works well. But don't forget, to be curious about your prostate cancer risk. Talk to your family, talk to your siblings, talk to grandpa, your dad. Just make sure you understand what your risk is, because screening may be something that you want to consider at an early age, like 45 or 50.
Well, thank you very much, and I look forward to us having another conversation in the near future. But thank you for your time today.
If you enjoyed this episode, please subscribe to my channel and share the episode with a friend or family member. All of our episodes are also available on audio on all your favorite sites. Support our podcast at buymeacoffee.com/realhealthblackmen.